Danielle back here, Danielle's Homemade Products. I'm here with Skye. She wants me to tell you about her birth because I just talked about my first miscarriage. I did have a second miscarriage as well. So I'll briefly go into that one because, like I said, this is my miracle kid. She's got some press-on nails on and she's feeling really super special right now. You need to brush your hair. You got a cockatoo thing going on.
I already did.
But anyway, I wanted to talk about her birth real quick because it has affected my teeth horribly.
I ripped her organs.
She actually did. Skye was my third pregnancy. My second miscarriage went somewhat similar to my first, but instead of my water breaking, my cervix dilated 4.5 centimeters, and I was only about 16 and a half, 17 weeks.
I did a lot of damage.
That one I ended up having to be sent down to the emergency OR for an emergency D&C because I was hemorrhaging. I birthed the placenta, but the baby would not come out. They couldn't get her to come out. Also was another girl. So I ended up having to have an emergency D&C so that I didn't bleed to death. But Skye, when I got pregnant with her, I won't lie, I was scared to death because I had already done this twice and it did not end well. So with Skye, I had my cervix stitched closed at 12 weeks. They put stitches in to hold it closed to try to prevent it from dilating on its own before I was ready. And excuse me, I need a drink. My mouth is dry. No, that's my daily allotment of soda. You cannot have any. But anyway.
Don't drink it anyways.
I'm sure you do stink it. But anyway, I found out I was pregnant with her. So I had my cervix stitched at 12 weeks. Kind of like, they explained it to me as like a purse satchel where you tighten the drawstring is kind of how they did mine. I was awake during the procedure. So, I mean, I really didn't feel nothing but them tugging. And they gave me a spinal, which while I was in there, I started giggling and the nurse gave me a funny look. I was like, sorry, my butt just went numb. And the nurse kind of giggled along with me, and I was like, sorry, it's you either laugh or you panic because you're like, I don't know if this is supposed to happen. But anyway, I went in at 38 weeks and they removed, well, actually it might have been 36 weeks. I think it was 36 weeks. They went in and removed the stitches in my cervix and told me at that point in time I can go into labor at any time. I did have gestational diabetes with a Skye.
Aren't you supposed to wait 9 weeks for one baby to come out?
No, it's...
I'm not 9 weeks, I'm 9 months.
It's 40 weeks. You're pregnant for 40 weeks.
Oh, because I thought if you're having twins, then you have to wait 18 months for them to come out. Or to go into labor or whatever. Well, then I got everything wrong.
It's still 40 weeks, even with twins. Usually twins are born a little earlier than that. But anyway, they took the stitches out between 36 and 38 weeks. Again, Skye's going to be 10 in November, so it's been a while. Now, this stubborn child, I had gestational diabetes, so they told me I would not go to my due date. I would be induced before then if I didn't go into labor on my own naturally. Because of the gestational diabetes, it tends to make a larger baby. I was a smoker, so smoking also tends to give you low birth weight babies. So between the gestational diabetes and the smoking, I kind of giggle and say you were not 10 pounds.
I was 12 pounds.
No, you weren't.
You're
going the wrong way. Just chill out, relax. But I say the two kind of balanced each other out. Stop it or I'll have you leave. She was 8 pounds when she was born, a little over 8 pounds. I want to say she was 8 pounds, like 2 ounces or something like that. Like I said, it's been 10 years. I'd have to go check. And her baby book is home and we're at Nana's right now. Yeah, my stubborn kid here did not wish to be born at all. So I was induced. I went in at 7 o'clock in the morning and they gave me Pitocin and broke my water.
I thought I was born at 8 o'clock at night.
Chill, please, chill. Impatient. Okay, so I went in, like I said, 7 o'clock in the morning. They gave me Pitocin and broke my water. At 12 o'clock, I was finally able to get an epidural because I had finally dilated to 4 centimeters. Unfortunately, for me, with my high tolerance to pain meds because of the migraines, my epidural wore off about 4 o'clock. And at this point in time, I had stopped dilating. They gave me a shot of pain medication and upped my epidural. So at that point, I was no longer able to move my legs on my own. And once they gave me the epidural, I had to stay in bed anyway. I had because of my fluffiness, we'll say, my contractions were not showing up on the monitors. So they ended up putting an internal lead on me, one on the top of her head and one inside of me so that they could monitor my contractions. So I was not allowed to get out of bed. They came in and cathed me every 30 minutes, which let me tell you is not pleasant, okay? But they came in and cathed me every 30 minutes. I was not allowed to get up and walk. I was not allowed to move. I was not allowed to get out of the bed. Once they gave me the epidural, I really was not able to even shift. I could still move my legs somewhat on my own, but once they upped the epidural, my legs, I had no feeling. They were dead weight. I had no ability to move them on my own. If I needed to shift position, I had to actually pick my leg up and move it, and then pick the other leg up and move it. So, 8 o'clock comes around, and they're getting ready to send me down for a C-section. I'm talking so much, my cigarette's going out. And I shouldn't say it was 8 o'clock. It was roughly probably about 7:30. And the doctor comes in for one final check before they send me down for a C-section. Yeah, I had fully dilated at that point. I was not a happy person because I was wanting this over with because I was miserable. I couldn't move, nothing. So, at this point in time, the doctor's freaking out. Now, mind you, I don't have my normal doctor. I have his partner in the little doctor's office that I went to because it was his partner's night on call. He's freaking out because he has a lady down on the table already for getting ready and prepped for a C-section, and I'm ready to push. Okay. So, he called the on-call doctor for the hospital who was there for that, and he came in and helped me deliver Skye. Skye was face up, so they had to turn her, mind you. So I've got this doctor that I have never seen in my entire life with his arm all the way up in my girly bits. So as I'm trying to push her out, he's pushing back and turning her. Let's just say I was not a happy person, especially considering the fact that my epidural had wore off again. Now, I still could not feel my legs. My legs were still numb. I could not move them on my own, but I had feeling in all of my abdomen. I had feeling everywhere else but in my legs. So at this point, again, she's face up, so they're having to turn her. And she ripped my cervix and gave me a not so fun episiotomy because of her big ass head. And because I am her mama, yes, I can say that. Yeah. So after she's finally born, I had an internal, they did 2 layers of stitches. I had an internal layer sewing my cervix back together, and then I had an external layer of stitches. And I'm sure anybody who's had a baby knows exactly what I'm talking about. Mind you, at this point, my doctor's partner is back. His woman that had a C-section was done. He had come back in. My uterus is not expelling all of the clots that were in it. So he reaches in with his glove. I mean, he's got gloves on, but he reaches into my uterus and tries to manually scrape my uterus by hand. At this point, I'm bawling because, again, I have no pain medication in that area. My epidural had been wore off for the entire labor experience, which was not pleasant, mind you. and I am just sobbing because he's pushing on 2 layers of brand new stitches, and I have no pain medication in me. I looked at the doctor and told him if he comes anywhere near me, I'm going to get off this table and I'm going to beat the crap out of him. Which is probably a mild version of what I actually said, because I'm sure I had some foul language in there, because he lickety-split left my room. And they sent me down to the OR again for surgery. To basically do an emergency D&C again, because my uterus was not contracting to stop the blood flow because of the clots that were still in my uterus. So they sent me down for an emergency D&C. Meanwhile, my 8-pound some ounce kid is the only baby above 6 pounds in NICU because I had gestational diabetes. Because I was in surgery, my mom gave her first bottle, and
I stopped breathing.
And then she stopped breathing, and they had to, sorry, she's messing with something on the table and making it shake.
I'm trying to fix my lightning button.
Okay, I understand, but you're making the table bounce.
Sorry.
So she ended up having to be stimulated in order to start breathing again. I didn't know this until 8 o'clock the next morning.
Nope.
Yeah, so again, they took me into surgery. Because again, once again, my high tolerance for pain medication, I was awake before my surgery, as I was entering into the recovery room. So I was awake for all of the cleaning and all of that fun jazz, and I was awake to give them permission to have my mom feed her first bottle.
And I stopped breathing.
Yeah, she stopped breathing. They had to stimulate her to get her back breathing.
Is that mean where they like rub the things to go and clear and then like they put it on?
No, I don't know what they did, because like I said, I wasn't there. Nana Karen was, so you might want to ask her. She might remember. But I had to, once I found out about it, of course, I was freaking out a bit, naturally. But she was fine at that point in time. But again, still the only 8-pound baby in NICU. And I kind of had to joke and say, yeah, she just wanted, she stopped breathing because she wanted them to know that even though she was the only 8-pound baby in NICU, she had to have a reason to be there. So she ended up staying in the hospital for 3 days. She had to go 3 days before, with no incidences of stopping breathing, before they would release her to me. So she spent an additional 3 days in the hospital after I was, or 2 days in the hospital, I believe it was, after I was discharged. So...
Wait, do you get charged for having a baby in the...
Yes, you have to pay.
What the frig?
But mind you, with my pregnancy with Skye, I was sick 24/7 for the entire 9 months, 10 months, because we all know it's 40 weeks, 40 weeks of my pregnancy. And she was only born a day before her due date. So I'm talking the full entire 40 weeks. I lost 20 pounds in the first month that I was pregnant because I wasn't keeping anything down. And I'm, like I said, I'm extremely fluffy, so I'm not going to even bullshit about what I weighed. When I found out I was pregnant with her, stop it, you're shaking my table again. When I found out I was pregnant with her, I weighed 275. The Friday before she was born, I was just back up to 275. So I gained 20 pounds at most because I was already heavy. So they really didn't want me to gain a whole lot of weight. But basically, the 20 pounds I lost in my first trimester, or first month of pregnancy, is all I gained during my entire pregnancy with her. I wasn't keeping barely anything down. So yeah, I was sick. It did some damage to my teeth, which is the whole point for this story. Now, I've had some dental work done, and it's certainly not from not taking care of my teeth, but I'm going to try to give you a close-up of my front teeth because they sustained and are easiest to see. But you can see the crack in it. That's actually not a crack. That is, the upper part of the tooth had to be filled, and the lower part of the tooth is my natural tooth. She's got some fireflies over here she's trying to show.
One.
She caught them last night. Okay, back up, baby. My teeth have, and mind you, it's not just my pregnancy that damaged my teeth. I grind my teeth horribly. I have to wear, or I should say I'm supposed to wear, a night guard at night because I grind my teeth horribly. from the 10 months of morning sickness that I had with her, I have absolutely no enamel on my teeth. None. And my back molars are grown so bad that my fillings are actually starting to pop up above the layer of tooth because the tooth itself is worn down so badly. I don't know if I can get you in a close-up for that. I don't know how well you can see, but just take my word for it. So basically, if you're looking at my teeth and going, why hasn't that bitch whitened her teeth to be in these videos? It's because there's nothing to whiten. I cannot whiten them because what you're seeing is not my enamel. It is the layer of dentin underneath it. And I cannot, that doesn't get white. Whitening strips would do no good.
Does whitening strips hurt you?
No, they don't hurt you. They just kind of bleach your teeth. But they bleach the enamel on your teeth, and I don't have any enamel on my teeth.
Do I have enamel on my teeth?
Yes, you do, because you haven't thrown up for 10 months. So my teeth look like they're bad. I definitely should have had braces as a kid. You can see my little shorty right there.
Oh, I have shorties that haven't grown
But
in
because of the constant vomiting, I have acid erosion really bad. Sorry, she's trying to go out back. I have acid erosion really bad, again, from morning sickness for 9 months, and any kind of acidic item like coffee, soda, anything like that. Please stop. I am still trying to record. Smoking doesn't help, and I know. I get yelled at all the time. Because it's actually dry, and that's another thing too. My medications, she's trying to drink my pop. The medication that I'm on for fibro actually gives me really bad cotton mouth. So I'm usually constantly drinking, which means I'm visiting the bathroom every like 20 minutes, it feels like. But the dry mouth is not helping. It's actually doing more harm to my teeth. Now, I did just have my cleaning done, I want to say a week or so ago, and they didn't have any dental work that they needed to do, which I am really grateful for because I hate dental work. Now, the problem with that is I cannot repair my teeth to the place that they would need to be. It would be an arm and a leg. The dentist told me in order to restore my teeth to the place that they should be, it would cost me a minimum of 10 grand. At this point, we're just trying to maintain what I have and try to prevent any further acid erosion, any further grinding, and any further enamel loss. The problem with not having any enamel on my teeth anymore is that brushing my teeth actually can erode some of the dentin away as well and erode my teeth even more. So my gums are starting to recede. I don't have gingivitis, which I am very thankful for, but I am a very big flosser because I can't take it. And I do brush my teeth, which I'm not going to lie and say I brush my teeth 8 times a day. No, I probably don't do it as often as I should, but flossing is something that I carry floss in my purse at all times because I can't stand having anything stuck in my teeth. But if you're looking at this and going, why, or any of my videos and going, why is she showing her ugly teeth on YouTube? There's a reason. It's not because I don't want to have pretty white teeth. I don't know anybody who would tell you that they wouldn't like that. But for me, it's not a valid option right now. It's not a possibility because it's just too expensive. I don't have that kind of money, and I don't know many people who do have that kind of money, to be honest with you. My family is certainly not rich. I'm certainly not anywhere near rich. But it's just a matter of trying to maintain what I do have and trying to prevent any further damage. So I thought I would come on here and kind of explain that there are people who don't have good teeth, and it's not because they're drug addicts. It's not because they don't brush their teeth. Sometimes there are things in life that just kind of take over, and you don't have really a choice. I didn't have a choice of having 40 weeks of vomiting with Skye. I don't know anybody who would choose that. That was one thing that I said. I was like, you know what? After being so sick with her during my pregnancy, I don't understand how anybody can vomit voluntarily. I really don't. I felt horrible all the time. I felt tired and drained and just weak. So I don't understand how anybody could want to do that to themselves. Now, I'm not saying that the people who do that are stupid. No, if if they're suffering from an eating disorder, it is a disorder for a reason. But I would suggest you find some help before it damages your teeth worse than it damaged mine, because that's something that everybody sees. And you don't want that to be the first impression of you. I know I certainly don't, but at this point, all I can do is prevent further damage. It may come to the point where I have to have all of mine pulled and get dentures. That may happen. My teeth are barely hanging on. I actually had one, last October, I did the abscess tooth video. I had one that abscessed. My dentist was actually surprised I wasn't having problems with that 2 years ago when I first started going to him. Because when the tooth was filled, the dentist that had filled it drilled it too deep and ended up exposing a nerve. So he was actually surprised I wasn't having any problems with it, and was not surprised when I told him I was having problems with it. He's like, we knew that was a possibility. I'm surprised, you know, we knew it could happen at any time. There was nothing we could do about it. Excuse me. He's like, we had already anticipated it. Now, he had not anticipated my face looking like I had gotten the tar beat out of me, but he had already known that that was going to be a problem tooth, and we were keeping an eye on it. Now, I do have some other teeth that they are watching. Like I said, I just had my 6-month cleaning done a couple weeks ago, so they have noted no additional damage in my mouth than what was there the last time I was there. And they are keeping an eye on the ones that could potentially be a problem. So when I go in next for my next 6-month cleaning, they'll check all of those again and see if they've gotten any worse or if they're the same. If they're the same, let's pray they're the same. But that's what they're doing. We're just trying to maintain at this point. But I just wanted to point out, the reason for this was because my teeth are not in bad shape because I didn't take care of them. My teeth are in bad shape because of a situation that was out of my control. I have no control over the teeth grinding at night. I'm not the only one who does it. My brother has to wear a night guard as well. My mom probably should wear one as well too. So, I mean, I can't control grinding my teeth at night. I do, however, notice that I grind my teeth when I'm angry or upset. So that is something I'm trying to keep myself from doing, because obviously I can't wear a night guard 24/7. I sound like I'm a boxer with it in. I slur really bad.
Do you have any like jars like this that are empty?
I don't know. I'd have to look. You're going to have to wait. But so not everybody who has bad teeth is from lack of hygiene. It's truly not. Not saying that couldn't be the case for some people, but I know I have friends that teeth aren't in the best shape, and it's not because they don't take care of them or brush them or floss them. It just really, medications can do some damage. Morning sickness can do damage, and you don't even realize it. So again, my teeth are horrible, but it's not because I don't care about them, not because I don't try to take care of them. It's just because of circumstances out of my control. So guys, I'll see you later. Have a good one. And again, if you're new to the channel, don't forget to subscribe, like, and leave me a comment down below. Let me know, and I'm going to try to make this and a little iCard. I'm still a newbie at that, so please forgive me if it's not in the right spot when it pops up. But I'll leave an iCard up there with a little poll. Let me know how bad your teeth are. Are your teeth wonderful? Are they okay? Are they poor? Just let me know in that iCard above, and we'll see you next time.